Hello students, in the last lecture we saw analytical epidemiology, in that case control and cohort studies. Now moving ahead, we will understand experimental epidemiology, in that principle and methods, basically randomized control trials. Fine. Now let's understand the history. Now in 1947, Lind tested the effect of lime juice on the occurrence of scurvy on a Royal Navy ship. It was a very major health problem that time. So he randomized his patients who received the treatment and who didn't receive the treatment with lime juice plus several other liquids as he tested. Fine. Next study was done by Sir Austin Bradford Hill on streptomycin for tuberculosis. Fine. The first established randomized control trial in medicine appeared in 1948. Entitled paper was Streptomycin Treatment of Pulmonary Tuberculosis, which described a medical research council investigation. One of the authors of that paper was Austin Bradford Hill, who is credited as having conceived the modern randomized control trials. Experimental epidemiology meant the study of epidemics among colonies of experimental animals such as rat and mice. Now in modern usage, this experimental epidemiology is often equated with randomized control trials. Now what is randomized control trials? Subjects in a population are randomly allocated into groups, usually called study and control groups, to receive and not receive any experimental, preventive or therapeutic procedures. Fine. Now the aim behind these experimental studies is to provide scientific proof of etiological means or risk factors which may permit the modification or control of those studies. Second is to provide a method of measuring the effectiveness and efficiency of health services for the prevention, control and treatment of disease and improve the health of the community. Fine. Now experimental studies have all the advantages as well as disadvantages of the usual prospective studies. Three additional problems which they faced is cost, ethics and feasibility. Fine. Experimental studies have become a major area of epidemiological studies, and they are conducted in animals or human beings. Fine. Now randomized control trials can be used to evaluate safety of a new drug in healthy human volunteers and assess treatment benefits in patients with a specific disease. Second, compare a new drug against existing drug or against dummy medication, means placebo. Fine. See, this is randomized controlled trial. How? Patients, two groups, treatment group, control group. Now random assignment is done. I'll explain what it is and follow up. And the results are compared. Fine. This is a general idea behind randomized controlled trials. Fine. Now, randomized means what? Eliminate bias in selection or allocation, balances all confounders which are known or unknown. Controlled means intervention compared to a control like active or placebo. Both groups identical except for intervention or exposure. Investigator has control over the process. Fine. Trial. Experimental intervention, where the effects are unknown to investigator. Fine. What is randomization? It's a process by which allocation of subjects to treatment group is left to chance, means, or their randomness. Fine. So now we will understand random assignment. What's its purpose? It ensures that the study groups are comparable on baseline characteristic. It tends to balance prognostic factors. Second, reduce selection bias in allocation to groups. Third, facilitate blinding. Fourth, facilitate measurements of outcome variables. Fine. There are three different randomizations: simple, block, stratified. What is simple randomization? This method is equivalent to tossing a coin for each subject that enters a trial. Head is active and tail is placebo. We do it every time. We toss a coin and we decide. However, imbalanced randomization can happen in smaller trials, reducing statistical power. Now see, for example, now in a trial there are 10 participants. Instead, there are grouping like 5-5 split or 7-3 split or 8-2 split. It can be any of these three. Fine. So that is imbalanced randomization. Understood? Block randomization. Block randomization is balanced within each block. Fine. The basic idea is to divide potential patients into some block of some size. For example, M block of size 2n. Randomize each block such that n patients are allocated to A and n to B. Understood? Then choose the blocks randomly. Means first only it is decided that how many number of people to be randomized or divide. Fine. Stratified randomization. Now, an randomized controlled trial may not be considered valid if it is not well balanced across prognostic factors. For example, age group less than 40 or 41 to 60 age group, more than 60, the gender male or female. So it has to be balanced. If it is not balanced, RCT is not considered. Fine. The block size should be relative small to maintain balance in small strata. Okay. Stratified. Now, on the basis of study design, there are 4 different groups: parallel group, crossover group, cluster, and factorial. Notice parallel group. Each participant is randomly assigned to a group and all the participants in the group receive or do not receive an intervention. Second is crossover. Over time, each participant receives or does not receive an intervention in a random sequence. Fine. What happens in cluster? Pre-existing groups of participants, example villages, schools, are randomly selected to receive or not receive an intervention. Fourth, factorial. Each participant is randomly assigned to a group that receives a particular combination of interventions or non-interventions. For example, group 1 receives vitamin X and vitamin Y. Group 2 receives vitamin X and placebo Y. Group 3 receives placebo X and vitamin Y. And group 4 receives placebo X and placebo Y. Understood? They are randomly assigned and they get a particular combination. Fine. Now let's see concurrent parallel study design. So this is the strategy. Defined population, it is randomized into two: new treatment, current treatment. Now in that we will get two other groups: improved, not improved, improved, not improved. This is the parallel study going on. Fine. Next is crossover study design. See, here you can see group 1, group 1, group 2, group 2. Fine, they both are different, they are observed. Then after a carryover effect, they are observed in cross, like randomize patient to different sequences of treatments, but all patients eventually get all treatment in varying order. The patient acts as his or her own control. They have no other control. Okay. So therapy A is given, therapy B is given. So this is crossover study design. What are advantages and disadvantages for crossover? Okay, let's understand first advantages. Influence of confounding factors is reduced because each crossover patient serves as his or her own control. Fine, here you don't require any other control. Next, patient assured that sometime during the course of investigation they will receive the new therapy. So it's a positive part. Disadvantage: not suitable if the drug cures the disease. Effective in certain stage of the disease or rapidly changing condition. Fine. The issue of order effects. It is possible that the order in which treatments are administered may affect the outcome. Okay. These are the disadvantage. Understood? Thank you.